So here we will now discuss the drug used in the treatment of irritable bowel syndrome. So first, let's define the meaning word per word of irritable bowel syndrome. Irritable is a caused by abnormal sensitivity. Bowel is a part of digestive system. It is made up of the small bowels and large bowel. Syndrome is a set of medical signs and symptoms which are correlated with other and often associated with particular disease or disorder. Irritable bowel syndrome is an idiopathic chronic relapsing disorder characterized by abdominal discomfort such as pain, bloating, distension, or cramps in association with alteration in bowel habit like diarrhea and constipation. So, to diagnose this patient should have abdominal pain at least once a week for the last 3 months, and it should also at least associated with diarrhea and constipation. Pharmacologic therapies for IBS are directed at relieving abdominal pain, discomfort, and improving bowel function. For patients with predominant diarrhea, anti-diarrheal agents, especially loperamide, are helpful in reducing stool frequency and fecal urgency. And sa patient naman with predominant constipation, fiber supplement may lead to softening of stools and reduce straining. However, may increased gas production may exacerbate bloating and abdominal discomfort. So dahil dito, yung osmotic laxative, especially si milk of magnesia, are commonly used to soften stool and promote increased stool frequency. For chronic abdominal pain, low doses of tricyclic antidepressant, example is si amitriptyline or disipramine, 10 to 15 milligram per dose appear to be helpful. So at these doses, these agents have no effect on mood but may alter central processing of visceral afferent information. The anticholinergic properties of this agent may have effect on gastrointestinal motility and secretion, reducing stool frequency and liquidity. Si tricyclic antidepressant may alter receptors for enteric neurotransmitters such as serotonin, affecting visceral afferent sensation. Several other agents are available that are specifically intended sa treatment ng IBS. Antispasmodic or anticholinergic, some agents are promoted as providing relief of abdominal pain or discomfort through antispasmodic action. Pero yung small or large bowel spasm kasi has not been found to be an important cause of symptoms in patient na mayroong IBS. Si antispasmodic, nag-work lang siya primarily through anticholinergic activities. So, yung mga commonly used medication in this class include si dicyclomine and hyoscyamine. This drug inhibit muscarinic cholinergic receptor in the enteric plexus and on smooth muscle. So by blocking their muscarinic receptor, this drug, they decrease the intestinal motility, but they will prove to be helpful in treatment of diarrhea predominant with IBS. The efficacy of antispasmodic for relief of abdominal symptoms has never been convincingly demonstrated. So, at low dose, they minimal autonomic effects. While at higher doses, they exhibit significant additional anticholinergic effect gaya ng dry mouth, visual disturbances, urinary retention, and constipation. So dahil sa mga reason na yan, yung antispasmodic, infrequently used lang siya. So madalang lang. Next is serotonin 5-HT3 receptor antagonist. 5-HT3 receptor in the gastrointestinal tract activate visceral afferent pain sensation via extrinsic sensory neurons from the gut to the spinal cord and central nervous system. Inhibition of afferent gastrointestinal 5-HT2 receptor may reduce unpleasant visceral afferent sensation, gaya ng nausea, bloating, and pain. Blockade of central 5-HT3 receptors Also, marireduce na din yung central response to visceral afferent stimulation. In addition, 5-HT3 receptor blockade on the terminal of enterocholinergic neurons inhibits colonic motility, especially sa left colon, increasing total colonic transit time. So, yung drug na include dito is si allosetron. Allosetron is a 5-HT3 antagonist that has been approved for the treatment of patients with severe IBS with diarrhea. So, meron tayong apat na example ng 5-HT antagonist. Ito si ondansetron, granisetron, dolasetron, and si palonosetron. So, yung apat na yan, nakikita natin sa right na mayroong picture na nagpapakita ng mga chemical structure nila. So in-approve sila para sa prevention and treatment ng nausea and vomiting. Ma-explain naman siya in detail sa antiemetics. Pero yung efficacy nila sa treatment ng IBS, hindi pa ganun na determine. The differences between these 5-HT3 antagonists that determine their pharmacodynamic effect, hindi pa siya napag-aaralan ng ganun. Pharmacokinetics and pharmacodynamic. Allosetron is highly potent and selective antagonist of the 5-HT3 receptor. So, rapidly absorbed siya from the gastrointestinal tract na mayroong bioavailability of 50 to 60% and mayroong plasma half-life ng 1.5 hours but a much longer duration of effect. Also, nag-undergo siya ng extensive hepatic cytochrome P450 metabolism with renal excretion of most metabolites. So, si allosetron, nagbabind siya with higher affinity and dissociates more slowly from 5-HT3 receptor than other 5-HT3 antagonists, which may consider for its long duration of action. Clinical use, allosetron is approved for the treatment of women with severe IBS in whom diarrhea is the predominant symptom. So, yung efficacy niya sa men, hindi pa ganun na-i-establish. In a dosage of 1 milligram once or twice daily, marireduce niya yung IBS-related lower abdominal pain, cramp, urgency, and diarrhea. Approximately 50 to 60% of patients report adequate relief of pain and discomfort with allosetron compared with 30 to 40% of 30 to 40% of patients treated with placebo. So yung placebo kasi, ito yung ginagamit sa clinical trial to test the effectiveness of treatment and also mas madalas siyang nagagamit para sa drug studies. And also, allosetron leads to a reduction in the mean number of bowel movements per day and improvement in stool consistency. Also, si allosetron, hindi pa siya na-i-evaluate for the treatment ng other cause ng diarrhea. Adverse effect. In contrast to the excellent safety profile of other 5-HT3 receptor antagonists, allosetron is associated with rare but serious gastrointestinal toxicity. Serious complication of constipation requiring hospitalization with or without surgery. So, si allosetron kasi, meron siyang side effect na ischemic colitis. So, dahil sa reason na to, si allosetron is restricted na siya to those patients who are not respond to the conventional therapies. So, drug interaction, despite being metabolized by a number of CYP enzymes, allosetron does not appear to have clinically significant interaction with other drugs. Next, chloride channel activator. Chloride channel activators, meron siyang dalawang medication or drug na related, na include, ito ay si lubiprostone. Lubiprostone is a prostonic acid derivative that stimulates the type 2 chloride channel in the small intestine. So by stimulating this type 2 chloride channel in the small intestine, this will cause increased chloride-rich fluid secretion into the intestine. So this chloride-rich fluid secretion will enhance the motility of intestine and will also shorten the intestinal transit time. Also, silobiprostone is approved for the treatment of women with IBS with predominant constipation and efficacy for men with unproven pa. So, the approved dose for IBS is 8 macrogram twice daily. Also, silobiprostone is ina-avoid siya sa mga pregnant women and sa women of childbearing age. Also, linaclotide is guanylate cyclase C agonist that leads activation of the CFTR. So, CFTR stands for cystic fibrosis transmembrane conductance regulatory in the small intestine with stimulation of chloride-rich intestinal secretion. So also si linaclotide ina-approve siya para sa treatment of adult with IBS with constipation at an approved dose of 290 macrogram once daily. Also si linaclotide is listed din siya sa category C for pregnancy and contraindicated siya for pediatric patient. So, lubiprostone in clinical trial up to 20% more patient treated with linaclotide than with placebo demonstrated significant clinical improvement. So, due to their high cost and lack of information about long-term safety and efficacy, the role of this agent in the treatment of IBS with constipation is uncertain. That's all for this video. Thank you.
Antiemetic agents. Before discussing this topic, let's first define emetic. Emetic is related to nausea. Yung nausea, ito yung pagsusuka na walang lumalabas mula sa bibig or yung tinatawag na pagduduwal. And yung vomiting naman, ito naman yung pagsusuka na may lumalabas mula sa bibig. Nausea and vomiting may be manifestations of wide variety of conditions, including yung mga adverse effect from medications, systemic disorders or infections, pregnancy, vestibular dysfunction, central nervous system infection, or increased pressure, peritonitis, hepatobiliary disorders, radiation or chemotherapy, and gastrointestinal obstruction, dysmotility, or infections. This will be treated by anti-emetic agents. These are the drugs that are effective against vomiting and nausea. So here are the anti-emetic agents. 5-HT3 antagonists, neurokinin 1 or NK1 receptor antagonists, corticosteroids, antimuscarinic, specifically scopolamine, antihistaminics, phenothiazines, and cannabinoids. First antiemetic agents is 5-HT3 receptor antagonist. The mechanism of action is 5-HT3 blockade in gut and CNS with shorter duration of binding than allosetron. Yung allosetron is a serotonin 3 or 5-HT3 receptor antagonist na merong action for prevention of nausea and vomiting, but it is mainly used for treatment of diarrhea and abdominal discomfort na nangyayari for some women with irritable bowel syndrome. Yung short duration of action is malalaman nyo later. So sa ating katawan, merong dalawang location yung 5-HT3 receptor. Una yung sa gut and sunod is yung sa CNS. So unahin muna natin yung 5-HT3 receptor sa gut. So ito yung gut sa gut or gastrointestinal merong enterochromatin cell na kung saan matatagpuan siya sa stomach. So, kapag zinom mo yung stomach, meron doong deep pits and gland, and may mga cell doon, and isa doon yung enterochromatin cell. Etong enterochromatic cell is magre-release, ang responsible niya is magre-release siya ng ng serotonin in response sa cytotoxic agent by chemotherapy. Kasi kapag nag-chemotherapy ang isang cancer patients, mayroong cytotoxic agents na um, na pupunta sa ating na papasok sa ating katawan, and then itong cytotoxic agent na to is mapupunta siya dito pwede siyang mapunta dito sa may sa stomach na kapag na-detect ni enterochromatin cell na merong paparating na cytotoxic agent, ang gagawin niya is magre-release siya ng serotonin in response doon sa pag-detect niya ng cytotoxic agent, and then itong serotonin na na-produce ni enterochromatic cell is magbabind siya kay 5-HT3 receptor, na yung 5-HT3 receptor is matatagpuan sa vagus nerve, sa vagal afferent. And itong vagal afferent na to is responsible para mag-send ng information na na-receive niya pagka-bind doon sa pag-activate ni 5-HT3 receptor, and yan, mag-resend siya ng signal doon sa vomiting center, and pag na-stimulate si vomiting center, magpo-produce ng vomiting reflex, kaya magpo-cause ng nausea and vomiting. However, because of anti-emetic agent, ang gagawin niya is ibablock niya si 5-HT3 receptor na makikita dito sa vagal nerve. So, ang mangyayari, kahit may dumating na cytotoxic agent na magkakos ng enterochromatin cell para mag-produce ng serotonin, na si serotonin hindi siya makakapag-bind kay 5-HT3 receptor dahil na-block na yung 5-HT3 receptor. So ang mangyayari nito is ma-influensyahan niya yung pag-prevent ni vagal nerve na mape-prevent niya yung stimulation ni vagal nerve or yung action niya sa pag-send ng information doon sa vasomotor center. Causing of vasomotor center will not trigger a vasomotor reflex or emetic reflex. So, next naman yung sa CNS. Dito sa CNS, there is a chemoreceptor trigger zone which has a 5-HT3 receptor. So, meron pang iba pang receptor dyan. So, focus muna tayo sa 5-HT3 receptor. So, ang mangyayari dito, this will be blocked by anti-emetic drugs. So, yung cytotoxic agent from chemotherapy, hindi siya makakapag-bind kasi ang cytotoxic agent is magbabind siya dapat kay 5-HT3 receptor na located kay chemoreceptor trigger zone. Pero dahil na-block siya ni anti-emetic agents, hindi siya makakapag-bind. So, mape-prevent, dahil dito, mape-prevent yung pag-send ng signal, hindi ma-activate si 5-HT3 receptor, and then, hindi makakapag-send ng signal sila sa vomiting center and yung vomiting center or emetic center, it will not produce ng emetic reflex or vomiting reflex. That will not cause vomiting and nausea. So, walang mangyayaring vomiting and nausea sa pasyente. So, ayan siya. Then, ito yung kabuuan ng yung sa taas niya. Yung sa taas niya, ayan. Ito yung nasa taas na sa brain. So, ayan, pinakita ko lang. Tapos, next is, Ito yung sinasabi ko kanina sa brain, sa CNS part na sa chemoreceptor trigger zone, meron pang ibang receptor which are the merong mga chemoreceptors which are the dopamine receptor, NK1 receptor, and 5-HT3 receptor na pinagbabaindan ni cytotoxic agent para mag-cause ng pagsusuka and nausea and vomiting. And ayan nga, sa gastrointestinal tract, merong 5-HT3 receptor. The effects and clinical application of this 5-HT3 receptor is extremely effective in preventing chemotherapy, induced nausea and vomiting, which is a first-line agent. Kasi nga, di ba, ang cancer patient nga, ulitin ko, kapag nakakaranas siya ng nausea and vomiting kapag nag-undergo ng chemotherapy, which I explained earlier, yung reason behind it. So, when used alone, it has a little or no efficacy for prevention of delayed nausea vomiting. Yung delayed nausea vomiting, ito yung nangyayari sa patient kapag, it means that, ito yung nangyayari sa patient kapag nag-undergo ng chemotherapy. Starting from the time nag-chemotherapy siya, then kailangan maghintay pa ng 24 hours, doon niya lang mararanasan yung, after more than 24 hours, doon niya lang mararanasan yung nausea and vomiting. So, yun yung tinatawag na delayed nausea and vomiting. So, it is most effective when given a single dose by intravenous injection 30 minutes prior to administration of chemotherapy. With the following doses, these are the following doses of the drugs. So, ondansetron 8 mg, granisetron 1 mg, dolasetron 100 mg, and palonosetron 0.25 mg. A single dose given 1 hour before chemotherapy may be equally effective in following regimens: ondansetron 8 mg twice daily or 24 mg once, granisetron 2 mg, dolasetron 100 mg. Although 5-HT3 receptor antagonists are effective as single agents for the prevention of chemo-induced nausea and vomiting, their efficacy is enhanced by combination therapy with corticosteroid, specifically yung dexamethasone, NK1 receptor antagonist, dopamine or D2 antagonist. It also treats post-operative nausea and vomiting. Dahil sa mga adverse effects and increased restriction on the use of other anti-emetic agents, 5-HT3 receptor antagonists are increasingly used for this indication. Ito rin ay effective in the prevention and treatment of nausea and vomiting in patients undergoing radiation therapy to the whole body or abdomen. The 5-HT3 receptor antagonists are well-tolerated agents with excellent safety profiles. The most commonly reported adverse effects are headache, dizziness, and constipation. Adverse effect is ventricular tachycardia, torsades de pointes. All four agents, yung ondansetron, granisetron, palonosetron, and dolasetron, it causes a small but statistically significant prolongation of QT interval. When we say QT interval as related to cardiac arrhythmias topic, it is the duration of ventricular electrical systole, and kapag nagkaroon ng QT prolongation, it leads to dangerous heartbeat episodes like mabilis na pagdipok ng puso. Yun nga yung ventricular tachycardia or specifically yung torsades de pointes because of taking serotonin antagonist or 5-HT3 receptor antagonist. This adverse effect may trigger suddenly faint and worst is death. And for more information, this adverse effect is most pronounced with dolasetron. Serotonin syndrome has been reported in patients taking 5-HT3 receptor antagonists in combination with other serotonergic drugs like selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. Etong serotonin syndrome, it is about too much serotonin in your body that has bad effect in your body and can lead to death once it is untreated. It has low toxicity. Reduction of stomach acid may reduce absorption of some drugs and increase that of others. All four agents undergo some metabolism by hepatic cytochrome P450 system, but they do not appear to affect the metabolism of other drugs. Half-lives much shorter than duration of action. However, other drugs may reduce hepatic clearance of 5-HT3 receptor antagonists, resulting to altering or changing their half-life. Yung first three agents such as ondansetron, granisetron, and dolasetron, meron silang serum half-life of 4 to 9 hours and may be administered once daily by oral or intravenous routes. All three drugs have comparable efficacy and tolerability when administered at equipotent doses. While yung palonosetron naman, it has a greater affinity for 5-HT3 receptor kaya mayroong serum half-life siya na 40 hours. Dose reduction is not required. Again, ang lahat ng mga apat na drugs is nag-undergo ng extensive hepatic metabolism and are eliminated by renal and hepatic excretion. Pero yung dose reduction is not required naman sa geriatric patients or patient with renal insufficiency. While for patient naman with hepatic insufficiency, dose reduction may be required with ondansetron. Next naman is yung anti-emetic drugs is neurokinin receptor antagonist. It has a anti-emetic properties that are mediated through central blockade in area postrema. Kasi nga 'di ba yung neurokinin is sinabi ko kanina na meron siyang is receptor siya na located doon sa chemoreceptor trigger zone. So ayun. And aprepitant, netapitant, and rolapitant, these are all oral formulation and are highly selective NK1 receptor antagonists that cross the blood-brain barrier and occupy brain NK1 receptors wherein napipigilan or napiprevent yung pag-stimulate ng vomiting center in the brain which interfere vomiting or emetic reflex. It has no effect on 5-HT3 receptor, dopamine, or steroid. So, nakafocus lang siya sa neurokinin receptor. Yung neurokinin receptor antagonist. All three agents are metabolized by liver primarily by the CYP3A4 pathway. Ito yung mga aprepitant, netapitant, rolapitant. The oral bioavailability of aprepitant is 65% and the serum half-life is 12 hours. Netapitan and rolapitan have longer half-lives, which is 90 and 180 hours respectively, allowing single-dose administration. Effects and When it comes to effects and clinical application, it is effective in reducing both early and delayed emesis in cancer chemotherapy. Here are the monotherapy and combined therapy for NK1 receptor antagonists. NK1 receptor antagonist in combination with 5-HT3 receptor antagonist and corticosteroid. Combined therapy with NK1 receptor antagonist, a 5-HT3 receptor antagonist, and dexamethasone, wherein this combination has greater percentage of population to treat kapag tinitake ng walang this combination has a greater percentage of population to treat than tinitake ng wala yung NK1 receptor antagonist. So, mas better na merong NK1 receptor antagonist together with the other antagonist drugs. There is also oral NK1 receptor as mentioned earlier, and for patient na hindi tolerable with this, there's naman na intravenous, which is fosaprepitant. They administered it to patient before or after chemotherapy with its dose for prevention of induced nausea and vomiting. Also, the addition of antipsychotic agent olanzapine, it decreases the incidence of acute and delayed nausea and vomiting with highly emetogenic chemotherapeutic regimens by 15 to 30%. Adverse effects are low incidence of fatigue and dizziness, as well as diarrhea and also CYP interactions. Drugs that inhibit CYP3A for metabolism may significantly increase aprepitant plasma levels, and these are the drugs, yung ketoconazole, ciprofloxacin, clarithromycin, nifazodone, ritonavir, nelfinavir, verapamil, and quinidine. Next antiemetic drugs is corticosteroid. The mechanism of action nito is not known but useful in antiemetic IV cocktails. So, ang ginagawa niya kasi dito is ini-enhance niya yung efficacy ng 5-HT3 receptor antagonist for the prevention of acute and delayed nausea and vomiting in patients receiving moderately to highly emetogenic chemotherapy regimens. Here are the drugs: dexamethasone. It is intravenous, which is commonly administered. Methylprednisolone. Next antiemetic drug is the antimuscarinic. Specific drug is scopolamine, and it is effective in emesis due to motion sickness. And this motion sickness, it is because it is a prototypic muscarinic receptor antagonist. When this scopolamine taken orally or parenterally, it has a very high incidence of anticholinergic effect. So, it is preferred na kasi tolerable ito as a transdermal patch. Next, antiemetic drug is antihistaminics. It is a moderate efficacy in motion sickness and chemotherapy-induced emesis. Moderate efficacy meaning it has the weak anti-emetic activity. Although, itong antihistaminic is particularly useful talaga for the prevention or treatment of motion sickness. Their use may be limited by dizziness, sedation, confusion, dry mouth, cycloplegia, and urinary retention. The drugs are diphenhydramine and one of its salts, dimenhydrinate. It has the first generation histamine H1 antagonist that also have significant anticholinergic properties. Dahil meron itong sedating properties, diphenhydramine is commonly used in conjunction with other antiemetics para sa treatment ng emesis due to chemotherapy. Next is meclizine. Ito ay H1 antihistaminic agent with a minimal cholinergic properties that also causes less sedation. Again, itong antihistaminics, they are actually for usually used for prevention or treatment of motion sickness, but they has the weak antiemetic activity. Kaya nagagamit din siya as somehow for emetic, for emesis. Next is phenothiazines. It is an antipsychotic agents which has antiemetic properties by acting primarily through blocking of the D2 and muscarinic receptors. Other antipsychotic drugs that has antiemetic properties are prochlorperazine, promethazine, titulperazine, olanzapine, or thiazobenzodiazepine, butyrophenones, and droperidol. These agents most commonly used as antiemetics are prochlorperazine, promethazine, thiazolperazine. And yung antiemetic property naman ng olanzapine, thiazobenzodiazepine, may be attributable to inhibition of dopamine D2 and serotonin 5-HT1C and 5-HT3 receptors. Antipsychotic butyrophenones, it possesses antiemetic properties due to their central dopaminergic blockade. And then itong droperidol, it may occur extrapyramidal effects. Again, itong extrapyramidal effect, it is due to lower level of dopamine. Kasi nga, nabablock niya yung dopamine receptor na dapat sana pagbabayanda ni dopamine. And also, it has an hypotension effect. And also, maaari ding maprolong yung QT interval. Yung kagaya nga na na-discuss, ang QT interval, ito yung rarely resulting in fatal episodes of ventricular tachycardia, including torsades pointes, which na-discuss ko kanina. Therefore, droperidol ay hindi pwede ibigay for patients with QT prolongation and should be only used in patients who have not responded adequately to alternative agents. Cannabinoids, the drug of it is dronabinol, is available for use in chemotherapy-induced nausea and vomiting, but is associated with CNS marijuana effects. Because of this availability of more effective agents, dronabinol now is uncommonly used for the prevention of chemotherapy-induced nausea and vomiting. The combination therapy with phenothiazines provides synergistic antiemetic action and appears to attenuate the adverse effect of both agents. Meaning, kapag pinapababa nila yung adverse effects na nangyayari doon sa dalawang drug kapag pinag-combine sila, which is yung phenothiazines and dronabinol. Adverse effects include euphoria, dysphoria, sedation, hallucination, dry mouth, and increased appetite. It has some autonomic effects that may result in tachycardia, conjunctival injection, and orthostatic hypotension. And last antiemetic drug is benzodiazepine. It is used before the initiation of chemotherapy to reduce anticipatory vomiting or, or vomiting caused by anxiety. And the drugs are lorazepam and diazepam.